Our next story is about healthcare in the rural areas of the United States and how the Internet of Things is helping doctors and emergency medical technicians make real-time, life-saving decisions for heart attack patients.
In rural America right now, hospitals are 40, 50, 60 miles apart at best, and major medical centers that provide specialty care usually 100 to 200 miles apart.
The area Blue Ridge operates in is a rural mountainous area. Response times that can take up to 15 minutes to 20 minutes to get to a person's house. And then once we start treating, we're looking at anywhere from 30 to 45 minutes transport time to get to the medical center.
People are delayed in calling 911 when they're experiencing chest pain. And the longer time it takes, the more heart muscle is damaged before we get the vessel open.
Time is muscle. We know that from all the experience nationally, and so anything we can do to advance the care, get them into the cath lab quicker, far superior outcomes, and again, some of our best outcomes have come when EMS has given us the pre-alert.
Working with Cornerstone integration, the Valley Health Center turned to an end-to-end solution based on Intel technology to reduce the time for a patient from the onset of a heart attack to receiving specialized medical care at a catheter lab at a major medical center.
The EMS provider has always been challenged with that, where do I go with this patient? And they've been on the hook for making that decision. And so to collaborate real time with the emergency medicine doctor, both at a potential receiving facility 100 miles away, as well as one that's 10 miles away simultaneously, to create really a conference call at that time is now enabled. We can do that now in ways we could never do before.
The data is connected on a 12-lead monitor defibrillator. That data is then transferred either to a computer or to a phone, where then it's electronically transmitted to a back-end server, which then looks at the address and the header and routes that data to the appropriate facility. And it comes here on a server and pops up within the emergency department and the cath lab for display on the charge nurse or the doctor's computers.
Cornerstone's Steve Graves tells us that this technology is affordable and scalable.
vPro AMT, active management technology from Intel, drives the total cost of ownership and operations of our enterprise down to the lowest possible cost. We've grown to over 300 mobile units, all using vPro that we manage remotely across 3 states.
The most important question is whether this technology helps to save lives. Kayla Roberts tells us about one individual who was helped by this solution.
And this gentleman is about 75 minutes away from the hospital. An EMT provider performed a 12-lead, transmitted it to the hospital where they activated the cath team. The cardiologist was waiting for him at the ER doors. He was whisked to the cath lab and had a door-to-balloon time of 14 minutes. And that is a significant time, and it saved his life.
What I'm most proud about is the fact that our technology, based on Intel end-to-end architecture, has helped save lives. When I walk into the hospital and a doctor or a nurse or an EMT tells me a story about what just happened and how they were instrumental in saving that patient's life using our tools, it makes me very proud.
Chief Jason Burns of the Blue Ridge Fire and Rescue says that calming a heart attack patient to reduce their level of anxiety is big. He says that telling them that he's already taken a picture of their heart and has sent it to an emergency room physician who will be ready with that information when the patient arrives does just that.